Joining me now is the director of the National Institutes of Health, Dr. Francis Collins. He appeared before the Senate Help Committee last week regarding the status of COVID-19 vaccine development, and he is someone to whom we can turn for accurate information. Dr. Collins, the concept of vaccine development cannot be reduced to bumper stickers and tweets because there's a lot of complexity. There are lots of vaccines out there for trial. There are tests about safety, and there are tests about efficacy. And then there are issues about distribution and who gets what when. So in your esteemed opinion, because you think about these things and you have the latest research, where are we really?
Well, I think it's fair to say we've moved forward with vaccine development and testing at a pace that's never previously been achieved by an enormous amount of energy and effort and resources being put forward by our nation's best scientists, both in the public sector and the private sector, working together in unprecedented ways. And I think you could say at this point that things are on a pretty good path with now phase 3 trials underway in the United States for 3 different approaches to this, although one of them is currently on a pause that we might want to talk about. That involves enrolling 30,000 individuals for each of these trials and then looking to see in the real world, does the vaccine provide protection and is it safe? And we are on the path towards determining an answer to that. And I think most of us, including myself and Dr. Fauci, who's my colleague, who's the most expert in infectious disease, would say we're reasonably likely to have at least one vaccine that's judged safe and effective by the end of 2020. But to get it much sooner than that would be perhaps a bit startling. We wanted this to happen as quickly as possible. People are dying. We're approaching 200,000 deaths in our country.
But this, just let's be clear about why we want this to be as careful and deliberate as possible, because there are lots of people out there saying, please get us a vaccine as soon as you can. The problem with the vaccine, if we don't go through all the protocols, which to regular people might seem overly rigorous and difficult, is so that we don't make people sicker by giving them a vaccine, or we don't make them sick with something else, or we don't kill them inadvertently.
Exactly. We're talking about giving a vaccine to currently healthy people. You should have a very low tolerance, therefore, for anything that's a serious side effect. Okay, if somebody has a sore arm, we can probably work with that. If somebody gets a temporary low-grade fever, we can work with that. But nothing more serious than that would be appropriate for a vaccine that you're talking about giving to hundreds of millions of people, which is why you do these very large-scale tests, trials, to find out, is it safe and does it work? And I just want to reassure everybody who's listening, we are not going to make shortcuts in that assessment of safety and efficacy. This is in a place where there are multiple different layers of oversight of this to make sure that nothing gets pushed through unless it meets the highest standards. Probably the highest standards that ever have been applied for a vaccine are going to be applied in this situation.
I so want to believe you, Dr. Collins, and I do believe you, and I do trust you, and I do trust the National Institutes of Health, and I do trust public health officials. I have never asked a question about a vaccine that I was told that I needed to get. I travel a lot. I get immunizations for other diseases. I've never asked anyone. The doctors told me it's going to hurt for a couple of days, but I trust that it is safe. There is something happening today in the politicization of this discussion that for the first time will make me ask 3 times. I'm going to call you. I'm going to call Lori Garrett. I'm going to call Zeke Emanuel. And then I'm going to ask my doctor 3 times whether it's safe to take it.
Well, isn't it unfortunate that we've arrived at that situation, that we have in this country such a terribly fractured situation at a time where we're facing a global pandemic? And gosh, you would really think Americans could all be together, but that's not the way we seem to be at the moment. I hope we can kind of put aside all of that emotion and realize this is about saving lives. Let's look at the data, people. And when I look at those polls that say less than half of Americans at the present time would take a vaccine if we had it, that's deeply troubling. And again, I hope that is a temporary view based upon a lot of political noise, and that when we actually have the data, people will look at it and go, okay, I can see this is what we know about this. That seems like something I'd want to take advantage of. Because, you know, this is not over. COVID-19, if we don't end up with a large proportion of the population vaccinated, this is going to go on a long, long time. Is that what we want as a nation? If we have a chance to put this in the rearview mirror, shouldn't we do that?
Yep. Yeah, it's amazing that you and I are going to be on TV dealing with that other problem next. The people who won't take it because they've become distrustful of the system. Talk to me about the fact that of the 150 or so candidates in the beginning, we've got 3 that are looking pretty serious right now, but 1 has been paused. Why?
So this is, in fact, something that I think ought to reassure people about the attention to safety. A single patient, in this case, a woman in Britain who was one of the volunteers for the vaccine that's being sponsored by AstraZeneca, developed an unusual neurological problem called transverse myelitis. Now, with tens of thousands of people getting the vaccine, it's entirely possible this was just something that was going to happen anyway. But you want to be sure about that. And so, in an abundance of caution, that trial has been put on clinical hold. No more people are being enrolled until they look very carefully across the UK, South Africa, Brazil, and the US, where this vaccine is being tested, to see is there any hint that anybody else had something like this. And until we know that for sure, that vaccine is on hold. One case. So isn't that
Which
actually
is the way it's supposed to be?
Yes, and it is happening. And again, no political interference is going to prevent that kind of scrutiny. That's how we do things right.
As I say every time I talk to you, Doctor, I hope you're right. I want you to be right, and you'll keep guiding us through it. Thank you, sir. Dr. Francis Collins is the director of the National Institutes of Health.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.